All right, good morning and welcome everyone to the third of 6 business and information listening sessions presented by the Wyoming Business Council. My name is Warren Appel. I'll be your facilitator this morning. Let's cover a few housekeeping matters and then I'll turn things over to Josh to introduce our agenda and panelists for this session. Written questions may be submitted using the Q&A function on the webinar toolbar. We will share these with the panelists as time allows. Please do not submit questions via the webinar chat box. Those do get lost in there sometimes. Individuals wishing to speak or ask questions should utilize the raise hand feature on the webinar toolbar. We will call on you as time allows. Please keep your microphone muted at all times when you're not speaking and keep background noise to a minimum. This is a courtesy to all participants and will help ensure we have good audio on our recordings. Speaking of, yes, we are recording today. We will make the recording of this session and all others available on our website, wyomingbusiness.org, as soon as possible. With that, I'll hand you off to Wyoming Business Council CEO Josh Durrell to introduce our speakers and agenda.
Yeah, thanks, Warren, and good morning, everyone. I really appreciate you all joining today and taking some time to understand how we can restart and take a small step in the direction of opening up businesses that were affected by orders 1 and 3, especially today. You know, as we have done these webinars, we've gotten some really great questions from businesses, and I hopefully have been able to help them understand the rules and make sure that they know how to begin to start back up. And for those businesses that are affected, we'll say this throughout the webinar today. But if you meet the guidelines that go into effect tomorrow, May 1st, you do not need to submit any new information to your county health officer, the state health officer, or the governor. You may begin operations in that limited capacity tomorrow. And again, that can be a little bit confusing with the orders, but we will walk through them today. And really, the goal of today is to show you what has changed in those orders, help you understand the best ways to make your business work within those guidelines. And of course, more than anything, allow you to ask questions. And as we go through this, I do want to just make sure that everyone understands that, you know, really from the state's point of view, we have been working tirelessly since this began with a number of people throughout the various agencies. Department of Health especially has been working more than overtime, I would say. And Stefan, who is one of our panelists, can tell you that really there hasn't been a free moment that they haven't been working on how to balance lives and livelihood in this whole process and making sure that the public health concerns are taken care of, but at the same time, realizing that each of our counties and our state may be a little bit different. And so trying to make a Wyoming solution for this. And I think that's really why you've seen the more relaxed than many parts of the country orders that have come out. And you've seen us really try hard to continue to open up those businesses that were affected. And what I would also say is that, you know, we've thought about this whole idea of back to normal, but frankly, normal is not going to be what it was in February, January of this year. It's really going to be quite different with your customers, with the way our society moves around. And so I want to make sure that we all understand that in this time, it's really important to work with your customers, communicate with your customers on what the expectations are, work with your employees to make sure that if they're not feeling well, that they go home, and do your best to ease into this so that we don't have to slip back and take those 2 steps back, because it can be a bigger challenge if we have to do that. And so we're going to be doing this in a data-driven way, and Stefan and Stephanie Pyle from the Department of Health will be able to talk through a little bit of those metrics and help us understand how we're driving this. But we're going to be looking at it in a way that is public health first and working to ease into the business side of the equation so that we can kind of get things running. And as Warren has switched over the slides to the agenda, and with perfect timing, I might add, we're going to take a look at a few things today. One, we're going to take a look at those health metrics, and we'll have folks from the Department of Health do that. We're also going to take a look at some of the businesses that were open, you know, throughout this period, although it may be in a limited sense, and some tools that those businesses can use to continue to promote themselves. We're going to take a look at orders 1 and 3 specifically, and many of you may not know exactly what those are, but we'll walk through them to show how they're going to now affect you in May 1st forward. And then we're going to take a look at a process that is the variance or exception process. And that way you can understand that if your business has been affected, but not really, it is not going to be affected in maybe a positive way on May 1st, how you can change and perhaps get a variance, or excuse me, an exception to that. And so we'll walk through all of that. And then of course, we'll take your questions. And, we mentioned it before, but we do have members from the Department of Health. We have Sharon Bennett from the Board of Cosmetology. And today we have Nikki Anderson from the Department of Family Services. So thanks to all of my panelists who have graciously provided their time at a time when they don't have a whole lot of that to share this information with businesses. And thanks to the almost 100 participants that are on the line right now. Thank you for being here. And without further ado, I'll turn it over to Stephanie or Stefan to talk through the metrics from the health perspective. Thanks.
Thank you, Josh, and good morning, everybody. My name is Stefan Johansson. I'm the Deputy Director for the Health Department. First, I want to thank Josh and the Business Council for arranging these webinars. I think so far the two that we've done have been extremely helpful, hopefully for the folks that are joining, but especially for us to see what questions are out there, how we can improve our information and our communication, and really better our communication on what's going on with these orders and how it impacts business. And then secondly, just want to thank all of you for joining and working with us while we navigate through some pretty untested times, some uncharted waters. So as Josh mentioned, we wanted to go over some of the metrics that the health department is looking at as it makes its decisions in conjunction with the governor and the governor's office on easing of restrictions that are related to the 3 public health orders. So on the left side of your screen, you'll see some what we call epidemiological metrics, and really looking at 3 at a high level. So we're looking at our total new cases over time and on a daily basis. And what we really want to see there is a sustained reduction over multiple weeks of the number of new cases each day. You'll see that it's highlighted in red as concerning because we do see, and we have seen, especially in the past week or so, some increases in the number of cases on a daily basis across Wyoming, and especially in a few counties in particular. So that's one that you'll see that has a red bar on it because we are seeing a concerning a trend there with the number of new cases. Secondly, we look at those cases, and our epidemiologists in the field, through what's called contact tracing, they try to determine what type of transmission occurred for the cases that came back positive, for the individuals that are diagnosed with COVID-19. And that's what we call either a case that's attributed to a known contact or a direct exposure. For example, if someone had a direct contact with an individual or a person in their community or their household or their family who had COVID-19, that's known as a direct contact or a direct exposure. When our epidemiologists can't trace someone's positive COVID-19 diagnosis to a known exposure or to a direct contact, then it's attributed to what we call community spread. And that means that there's wider spread of the virus out in the community, likely a wider spread of virus out in the community because we're unable to trace those contacts. And right now, statewide, we see about a 20 to 25% of our total positive cases that we attribute to community spread. And we really want to see that maintain or go down. We don't want to see that community spread metric get worse. So you'll see there in yellow, that has been stabilizing over the past days and weeks, which is why we're thinking it's moving in a positive direction. Third, on the epidemiological side, we look at our percent of our total tests that come back positive. And right now, statewide, out of all the tests that we do, we're seeing about between a 4 and 5% positive rate for all of our COVID-19 tests. And again, similar to the previous metric, we want to see that remain stable or even go down as we test more members of the public. And so you'll see that we're, as of April 28th, we're saying that is also stabilized or is stabilizing, which is good news. The second bucket that you see on the right-hand side of your screen is kind of tangentially related to the virus, where the state really wants to prevent and does not want to see, a surge on our healthcare system capacity, because that's where we could really see negative impacts of this virus, is if our healthcare system and our hospitals are overrun. So we've been tracking on a daily basis in conjunction with our partners in the hospitals who report these data to us every day, our total number of reported COVID-19 admissions at hospitals. We track that by every hospital and get those reports every day. And again, you'll see that that has also been stabilizing, which is really good news. We did see about a week ago, a little bit of a spike in hospitalizations, especially in the center part of the state, in Fremont and Natrona counties, and a little bit here in Laramie County down in Cheyenne. But statewide, we're seeing a relatively positive trends on our hospital capacity, which is good news. So similarly, we look at our total bed availability for everybody, not just COVID-19 patients, as well as our total ICU bed availability. And again, those metrics have been stabilizing over the past week and a half, 2 weeks or so, which is really good news. The final thing that I want to mention is we look at these metrics, really two things. Number one, we're looking at these on a statewide basis, and we're also looking at these on an individual county basis, because we know that no county in Wyoming is experiencing the same thing when it comes to COVID-19 right now. We have different pockets of the virus with more cases in certain counties and less cases, sometimes no cases in others. So we're trying to look at this, and we are looking at this as a statewide system, as well as on an individual county basis. The second thing that I want to mention is with these metrics, the 6 high-level metrics that you see on your screen, it's important to know that what we're looking at with this to make decisions on the public health orders, to make decisions with the governor, to discuss administrative changes or easing of restrictions that may be possible with these orders, we're trying to look at these metrics holistically. It's very difficult to tie, for example, if we reached a certain percentage of availability of ICU beds in the hospitals. That doesn't really tie directly to say, now we're going to open vocational schools or trade schools. There's not a whole lot of science behind tying the metrics directly to an administrative action in one of the orders. But if you take these holistically and kind of impressionistically, as we start to see more, to put it simplistically, more yellow and green on this chart here, then that gives us a sense as the Department of Health and as the governor that we can take on more risk with reopening or easing restrictions on certain businesses and certain parts of the economy, either on a statewide basis or on an individual county basis. So Josh, that's my overview of the metrics. I'm happy to answer any questions, but I know we typically hold Q&A till the end, but we can move on to the next slide if it's okay with you.
You bet. Thanks, Stefan. And just so everybody knows, we did get a question about the timing of things, and I think Stefan really nailed it. Is that timing is a challenging thing to guess right now because we just don't know. There are a lot of variables that play into that, and so the way these metrics play out are much more important than a day on the calendar. So thanks, Stefan, for going through that. So as we take a look at this, one of the things that we wanted to do was really help people understand that what businesses have been open, what businesses are still going to be open moving forward, and also ways to promote that out. And so this is a website that the Wyoming Business Council worked on to develop basically a map of businesses throughout Wyoming and give them an opportunity to make sure that their hours that they might be open in a limited capacity now, and the services that they offer, which may have changed from what we considered normal a few months ago, and be able to promote that out so that within your community, you could promote your business and show maybe the new services that you offer, maybe the limited hours, maybe those changes, but give you a way to do that. And if you go to wideopenwyo.org, and at the very top right corner of the screen, you can add your business and make sure that it's up to date. Now, we've been able to preload some of this from some Main Street communities and chambers of commerce who have provided information, but it's always a good idea to check that out and make sure that your business is correctly represented. One of the things that we noticed is that utilizing your social media outlets, making sure that your Google listings are up to date. This is a really critical thing, and this just represents another channel for you to be able to do that, because communicating with your customers at this time and making sure they understand what you're going through, as well as how you're offering your services to them, is really important at this time. And so as we jump to the next slide, we wanted to bring out a really what I thought was a very unique website, because it had a great number of great information that you were able to take a look at and hopefully utilize for your business. And this was something that our Main Street manager, Linda Klink, found and went to a webinar on. And it's called reopenmainstreet.com. And this was developed in the Southeast region of the United States, at one of those states. And as we looked at it, we realized that while their restrictions might have been a bit more stiff than ours, the principles and the guidance that they were providing to various levels of business was really fantastic. And so I would suggest that you take a look at this website, go out there and utilize some of the tips that they have come up with, and make sure that things are strong. And remember too that this website, as well as the information that's out there, can be really, really helpful. Sometimes when you're running a business and you're right in the thick of things, and things are a little tough, you tend to kind of internalize and maybe look a little too closely inside. But it's a good idea every once in a while to kind of take a deep breath, look outside, and get some outside perspective from sites like this, as well as other businesses within your community, so that you can stay strong and continue to collaborate with your community. So just an example of a great website that has information that would be useful to you. And with that, we're going to jump now into the childcare portion of Order 1, and to talk through that. And before we do that, I guess I will say, just to let everyone know, this may not appear on your screen large enough for you to read the specifics, but these orders are available on the governor's COVID-19 website, and you are able to go to that, and we have a link for that at the end of the webinar, so that you can see that. But to talk through this, we have Nikki Anderson today from the Department of Family Services, who will talk a little bit about the changes to Order 1 as it relates to childcare. Nikki?
Thank you, Josh. Good morning, everyone. I'm Nikki Anderson. I'm Child Care Licensing Program Manager for the Department of Family Services. I want to say that I too appreciate the Wyoming Business Council for hosting these webinars and providing the opportunity for folks to understand the orders and ask questions. You can see the requirements for child care providers from the new public health order on the screen. I want to point out that we have emailed the order to all child care providers for their review and for them to refer to as they are making decisions about reopening. Let me begin by saying we know child care is an essential part of the infrastructure of Wyoming, allowing essential systems to function. And as such, child care has been an interesting function since the state has begun to respond to this outbreak. Child care has been impacted in a different way. Not all child care was required to completely close. Many have been able to remain open to serve children of essential personnel. The new public health order allows for child care to reopen and/or expand who can be served, keeping in mind children of essential personnel are still a priority for service, and also keeping in mind the health and safety of children, families, and staff. We encourage child care providers to reach out to their local county health official to get guidance on the application of the public health order. The public health order is different than our child care licensing rules, and because of that, we also recommend that child care providers contact their licensor for technical assistance as you begin to operationalize the public health order. We recognize that some of the requirements may be tricky and there are some gray, but there are some child care providers who have remained open and found creative ways to meet the requirements and keep children and staff safe along the way. Your child care licensor may be able to connect you with a provider who has been operating and figured out ways to meet the requirements of the public health orders while still meeting the needs of children and families. Finally, I want to let you all know we are developing an FAQ with all the child care questions from these webinars, and we'll make it available to all child care providers as well as posting it on our BFS website. That's all I have, Josh.
All right, thanks, Nikki. I appreciate that. And we'll jump on to the next slide, but I think we do want to mention that the state agencies that are really the experts in this, in that case, Department of Family Services, have a lot of information and a lot of ways to help people. So making sure you reach out to your licensor as well as your state agencies, I think, is a great thing if you do have questions beyond that. And Nikki might have mentioned this as well, but just to reiterate, talking with other businesses and other, in this case, daycares that may have been open and have found some ways to meet these guidelines or meet the guidelines that have been in place is a really key thing. I think we've got to kind of have that sense of community and make sure that we collaborate with with the other businesses in our towns and across the state in order to find those best practices and learn from them. So now we're going to jump into restaurants and dining, and this is the one that probably many people were thinking, hey, I'm excited for May 1st because maybe I can start going out and eating some dinner at a restaurant and things like that. And so there were some minor changes to this, and I'm going to let Stefan talk through some of the logic behind this, because this one is something that I think you have to kind of think about a little bit more and really understand the intent behind the health component of this. So Stefan?
Thanks, Josh. So when we talk about order number one, we and Nikki did a great job explaining the changes to the child care provisions. As Josh mentioned, a lot of folks have been interested in other parts of order number one, which really haven't changed that much with this continuation. So starting with restaurants and dining, the major change that I'll mention first is allowing individuals up to 5 people in a restaurant to pick up food or beverage orders while maintaining, distance of 6 feet apart. That's really the big substantive change from the previous order to what's being continued tomorrow. And I know folks were looking forward, as Josh mentioned, to either going to a restaurant and having some lunch or some dinner with seating service, or providing that for those of you who own restaurants. And we're just not there yet. So when you looked at the metrics that you saw, while we're seeing some positive trends, I'll explain a little bit the logic from the Department of Health and the state health officer of those the three orders that were put into place. Order number one, as many of you know, was really closure of or service limitations on businesses that solicit larger gatherings of people. So when you think about restaurants, bars, schools, childcare facilities, et cetera, those typically are businesses that serve larger amounts of people at any given time. And what we know about this virus, about coronavirus right now, is very limited. But what we do know is that what contributes most to its transmission is when people are gathered in larger groups. So the logic of order number one was to restrict those types of businesses and entities that solicit larger gatherings of people in order to protect those staff and those residents, as well as limit the spread. Order number two that you might remember prohibited gatherings of 10 or more people, and think of that as your public events, where people congregate, et cetera. That was, again, the second step of really limiting the number of people that we have in certain spaces. And then order number three, which we'll talk about here in a minute, really represented businesses that are high touch. They might not be large groups of people, but represent more of a unique public health threat, like hair salons, massage therapy services, nail salons, tattoo services, et cetera. And those were, again, not necessarily large groups of people being served at one time, but unique high-touch businesses. And as we see those metrics that you saw on the slide a little bit earlier, as we see those improve, then we're kind of going in reverse order, where still what we know about the virus is the transmission really happens when people are in close contact, and especially when they're in larger groups. So we're starting with some of these restrictions on order number three and a few modifications to order number one. And then as we go forward in the days and weeks to come, monitoring those statewide and countywide metrics on the number of cases, those attributed to community spread, our healthcare system capacity, et cetera, we'll start to look at other provisions of Order 1, like restaurants, bars, schools, trade schools, et cetera, and potentially make changes here in the coming weeks on what, again, is safe to start to ease when it comes to those restrictions. So going back, again, what has changed here in Order Number 1 specific to restaurants and dining is really that ability for people to go into the restaurant to pick up orders. But we're still restricting seating service, dining service, et cetera. But it's important to notice, and I'll say this on all of these different descriptions of what has changed in the orders. There's two processes that we'll talk about a little bit more later, but it's worth mentioning now. For businesses to seek exceptions to these orders at the discretion of their county health officer, who works under the supervision and direction of the state health officer in the Department of Health. That's for specific exceptions to things that are in the order. And then at the county health officer's discretion, there's also a process for what we call a variance order. And that's if a county decides it wants to put its own order in place that is either more restrictive or less restrictive than one of these state orders. So again, we'll talk about that a little bit in more detail here in a minute. But with all of these, I want to reiterate that that doesn't mean that there's a guarantee that exceptions will be granted. But there is a process for a certain type of business, like a restaurant even, or a school or a trade school, to submit an exception request to the county health officer that will be considered by the county health officer and the state health officer for approval or denial. So Josh, I'll stop there and we can move on, and I know we'll answer a lot of questions at the end here.
Thanks again, Stefan. And yeah, this one is definitely a challenge for a lot of folks to kind of understand that. And again, I think we have to take a look at it and think, okay, we want to make sure that we are doing it in a way that eases this and that moves in the right direction without having to go out there and then take a step back, knowing that we do have a number of ways, and we'll get to those at the end, that a business or a county can seek a way to kind of make a plan that works better for their county. So I think that's something that we want to consider throughout this time, as we know that this is the portion where we get a few questions into the Q&A, and we appreciate those, and we'll do our best to cover those, or reach out individually afterwards as well. So thanks for covering that. We're going to jump onto the next slide, which I believe has to do with gyms and fitness centers, and that is really we don't have anybody from a trade association or any kind of department to go through this. So we're going to walk through this, and I'll take a stab at this and just talk a little bit about what has changed and what folks will be doing for gyms and fitness centers and the important components of this. And, so a few things to think about. One, on May 1st, gyms may open in a limited capacity if they meet these requirements. And we'll go through those quickly, and then I'll talk a little bit about what some of the gyms have been doing to make sure that we're meeting these. So staff must wear face coverings at all times. Management, and this is no different than many other requirements now, management needs to ensure that no employee who presents symptoms of illness will be permitted to work. One of the things that we get a question a lot about are what are the symptoms of illness for COVID-19? And the Department of Health is coming up with those guidelines as well, and we'll be posting on their website kind of a checklist of things to consider and make sure. No close contact activities, and you need to kind of think through all of these, but a couple examples are one-on-one personal training where you're inside of that 6 feet of social distancing, and then any kind of weightlifting that requires spotters. And I think at this time, we may just not go for our max for a little bit longer and not need that spotter there. Locker rooms where people could congregate and there's a lot of space that might need to be cleaned often those are going to remain closed. Workout equipment needs to be spaced no less than 6 feet apart and needs to be cleaned by staff between customers. And that's a challenge that people thought, well, gosh, I usually clean up my equipment afterwards as a patron anyway. Does the management need to do that? And one thing we want to mention is that, One, it's not everybody cleans their equipment the same way as a customer, but management has been trained, or the employees have been trained on the proper techniques to clean the equipment, and we'll make sure that it's done correctly. So we want to make sure that everyone knows that it does need to be cleaned by an employee between usage. And then a couple other things that are really notable. One of those is that the 9 people in a specific room or confined space, and really the key there is making sure that your space can allow for that 6 feet of social distancing, and that the equipment is spaced out as such. So in that confined space, say a separate workout room for a spin class or aerobics class or something like that, and or a small space cannot be there. And that brings us to classes, which are prohibited right now. So thinking about those gyms that might do classes, might have those kinds of events, those are right now not available. We have heard from people who've asked, hey, can I take a class outside and make sure, and you can do that as long as you have that 6 feet of spacing and do it outside of those group of those confined spaces. Keeping a record of those customers who come in, the date and time, as well as some contact information, which again, most gyms do. Because they have a membership and know who's there and when they're there, so that if any sort of contact tracing needs to be done, you can facilitate that. Now, you will not be responsible for doing the contact tracing, but the Department of Health would do that if someone presented or did have COVID-19 who maybe had gone to your gym in that time period. And then there are some space limitations that you need to respect. And then thinking about swimming pools and allowing 1 swimmer per lane, and then spas and saunas need to remain closed. So again, we want to think through those, make sure that we're doing a good job. And as I talked to gym owners yesterday after these came out, they said, well, one of the big things is we want to make sure that we're taking the time to make our gym available to do these things. But at the same time, we want to promote out to our customers what we're doing to meet these guidelines, because not only is it about making sure that you're doing it the right thing for these state guidelines, but making sure that your customers feel comfortable. And I think that's a really key component of this, is that because many people will not just jump back into their normal routine. And so making them feel comfortable and showing the ways that you're meeting these guidelines, I think is really important there. Stefan, anything to add on that particular slide?
No, maybe one thing, Josh. I think there's, we've heard and received a lot of questions and good feedback on, some of the details of these easing of restrictions and why did you do this and why didn't you do that? And the one thing I just want to reiterate is, keep in mind with the statewide order, we're trying to capture on a broad basis as much as we can, but knowing we will not hit all of the operations and be able to capture the detail of operations of different businesses across the state. And that's really where that exception and variance process comes into play. And again, I saw some questions come through on the Q&A about, hey, the Department of Health at the state is saying that exceptions and variances will be considered, but I've been told that the health department is not considering those. Keep in mind that on a county by county basis, where those exceptions and variance processes really start, if the county health officer is not at a point in their county with their cases, with the health data, with the epidemiological data, that's really where that's the gatekeeper at that level, is the county public health office. So I can't speak to some of the details of what has been said to certain businesses about exceptions or variances that will or won't be considered, but that is where that starts to get proposed to us at the state level for an exception or a variance process. But really, Josh, just want folks to know, we're sensitive to the concerns that we're not able to capture all of the operational idiosyncrasies across all of these businesses. And we know it's difficult. And we know that, it's not going to seem on paper like it captures everything that it needs to, both with restrictions that are in place or restrictions that are being eased. So we just encourage folks to, work with us, be patient with us, as well as work with your local partners, your county public health office on questions of interpretation on these orders, questions of enforcement on these orders. And Josh, I know you had mentioned this yesterday, but I think it's important to mention here that whether you're a gym or a restaurant or a bar or a hair salon or massage therapist, talk to your, like Josh mentioned before, talk to your colleagues that operate similar businesses, because in your town or your community, if you're all thinking kind of along the same lines, then you know that will help in communication with your county public health office on things that might be able to be eased, or if you know there's businesses that we've heard from that think that we're not being restrictive enough. So it's really a really important balancing act. But I think, as Josh mentioned at the beginning of this webinar, the more that we can collaborate and across our different industries and sectors speak with one voice, the more we're going to be able to work both at a local level and a state level to make sure we get through these periods as best as we can. Thanks, Josh.
Yeah, thank you, Stefan. All right, now we'll jump into Order 3, which has some fairly significant changes to personal services. And to talk about that, we'll have Sharon. Please join us.
Good morning.
Morning.
Thanks for doing this. I think these are extremely helpful. I know I've learned something every time I've been on here. So I think the biggest thing that I'm going to keep saying through all this is these orders say that you can be open on the 1st, but we're just really asking people to take your time, make sure that you do it the right way first. We're also getting a lot of calls from the public. We're asking them to also be patient with us. We realize that everybody is very ready to get their hair done. But you need to give your stylist and your barbers time to do this right. It's going to take longer to get you in. They're not going to be able to see as many clients in a day. So we're just asking for their patience and understanding as we move forward with this as well. Number C on our orders is the screening question. We've been getting a lot of calls on this, and I understand that the health department's going to have better clarification for us on that, and we'll put that on our webpage as soon as we get it. Really, just all the information we're getting is on our webpage. We're here. If we can't get an answer for someone, we'll find, you know, where that answer can be found, and just try to do your best. We're already an infection control agency. These people know what they're doing. They've been doing it all along. We just have to step it up right now, and we just want to be able to do this successfully.
Yeah, thanks, Sharon, and that's exactly right. And a couple really solid points there on, you know, doing it right, obviously, so that we don't have to go backwards perhaps, and then being creative about how to open up and maintain these guidelines. And again, I just want to stress that if you meet these guidelines on May 1st as a salon or barbershop or any other business that's listed here, you are allowed to begin this limited business operation without asking for permission. That is a real key component here. And then also just to as Sharon mentioned, you know, I'm sure your customers are sort of pinging you and saying, you know, when can I get in and get my hair done, my nails done, and things like that. However, don't feel like you have to open up on the 1st if you're not prepared. It is definitely better to be prepared and have everything set up correctly before letting clients in. So again, thanks a ton, Sharon. Really appreciate your help there, and your board's help as well. So thank you for doing that. All right, now we're going to jump into, let's see, we are going to talk a little bit about the variance and exception process. And I know that many of you who are chatting in for the Q&A can really, you know, this is where you want to really dig in and take a look at how you can navigate this. And to walk through it, Stefan, if you don't mind being able to take a look and walk people through this, would be great.
Sure, Josh, thank you. So in each of these 3 orders, and I know Josh and the Business Council are going to make these orders or have made these orders available. They're on the governor's website, they're on our website, Business Council website. So would encourage you, you know, go through as as fun as it is to read legal orders, I know, you know, that's not everybody's cup of tea, but it really is important to go through, you know, paragraph by paragraph, especially on the order provisions, and look at what the language says first and foremost. But in each of these three orders, there's a process for two things. One is an exception, like I mentioned before, and the second is a variance. And like I mentioned, a variance is really a completely different, completely new, distinct order that would apply on a county-wide basis. So if you think about, you know, gatherings of 10 or more, order number 2, a county could apply for a variance order that would completely change what's in effect for that entire county with order number 2, either more restrictive or less restrictive. That's what's known as a county-wide variance order. And then we have the exception request process, which is more of what we're talking about today, that a specific business who's not fully allowed through the orders to reopen yet, and you know, those businesses that Josh mentioned, like gyms, personal care services, et cetera, if you meet those conditions in the orders on May 1st, tomorrow, you can reopen without any exception or variance process. But for the other businesses that might still have order restrictions in place, the exception request process is important to understand how that works. And what we have ordered and would like to see with the exception request process is a local discussion on the exception or the variance that's being requested. So we'd like to see local partners, so yourselves as businesses, talking to your county health officer, who will communicate with county commission, law enforcement, county attorney if necessary, to make sure that it's understood what's being requested, either for a specific business or a group of businesses. That's really the first point of contact is again, the county public health office and the county health officer. That county health officer will consider any sort of planning documents that have been created. So, for example, a business saying, "Hey, here's how we're going to maintain social distancing. Here's how we're going to limit, you know, gatherings in our business or the volume of patrons or customers that we see. Here's how we're going to sanitize, et cetera. And we think we can do this safely." Many times, a county health officer will request that, you know, in writing in some sort of a planning document. And then ultimately, the county health officer says, I'm approving or denying of this. And we've seen a mixed bag of county health officers approving certain things, and some counties where we've really seen more concern with the virus. Fremont County comes to mind, where we really had kind of an outbreak and a cluster and some issues in that part of the state, where the county health office might be saying, you know, we're keeping the orders as is for now until we start to see improvement in the metrics. And that's an unfortunate reality that we're seeing in some places more than others across Wyoming. But in step 3 there, you'll really see that's where the county health officer has some discretion to approve or deny these specific requests. But if it's going to move forward from the county's perspective, then the county health officer discusses that request or that variance order with the state health officer and submits it, you know, sort of officially to the state health officer, who then, you know, step number 5, consults with our attorney general and ultimately approves or denies either the variance order or the exception request. So that's the process, is how it works when it comes to variances or exception requests. But what I really want to reiterate to all of you is what Josh mentioned at the beginning of this webinar, which is communication, either among yourselves as business owners or operators of businesses or employees of businesses. Communicate with each other, and then ultimately communicate with your county public health office on anything that any questions you have on interpretation or enforcement of these orders, as well as this process when it comes to exceptions and when it comes to variances. So Josh, I'll stop there and happy to answer any questions as we go forward. And Josh, I think you're on mute, FYI.
Yeah, thanks. Yeah, so this is about the time when we start to answer questions. And again, to reiterate, you know, it is ultimately up to right now the county health officer and that group and taking a look at their own metrics. And I think that's a key component. But this process is the process that any business can follow in order to find whether to do an exception or a variance. And some of the county health officers that I talked with in the past day or so have said, if possible, we would like to do, if possible, again, based on the metrics and based on what they can do, they would rather do a variance than have a million exceptions come in. So again, if you're a gym owner, work with other gym owners to come up with a plan, and restaurants and may do the same. But again, start with your county health officer and work your way that way. And at this point, we'll go ahead and open it up to questions. I do want to let people know down at the bottom of the screen, you'll see the link to the complete public health orders, and that's where it gives you the exact wording on all of those. And please take a look at those and become familiar. We are recording this session. In terms of getting this slide deck out into the public domain, we're working through that process now and may be able to post those, so stay tuned on that. And then with that, we're going to take a few questions. I'm going to take a look and see if anyone wants to do that live, but we'll also take some questions that have been put in through the question and answer section. And so this is the first one. I think this is a really good one. It has to do with contact tracing. And so Janine asks, are other businesses required to keep contact lists for follow-up? Restaurants with customers doing pickup or eventually sit down, and that's a question. Libraries when they reopen, and how are these records kept? And Stefan, I don't know if you want to talk about that or if you want me to take a stab at it.
No, it's a great question. Just an initial answer here, the easing of restrictions that you see in order number 1 and order number 3 effective tomorrow, especially when it comes to gyms and when it comes to personal care services, that's where you see in the order a requirement for some logging of customer information to help facilitate contact tracing. And the idea there is if we do see a resurgence of the virus in any of these types of settings where we've eased restrictions, that's going to facilitate our epidemiologists being able to determine if we need to take action on more restrictions, and especially to keep those people safe who might have come in contact with others. But there's no requirement on a wide scale, statewide, for the other businesses that aren't specifically mentioned in these changed orders to have that type of customer information logging. But for the restrictions that were eased primarily on gymnasiums and personal care services, that is contained in the order to be able to have that information. And like Josh mentioned, especially when it comes to gyms, a lot of that's already available, but there's not necessarily, that's not something we're micromanaging from the top of how that needs to be collected, how that needs to be logged, what type of spreadsheet you need to have. We're just asking through the order that in order to facilitate that contact tracing that we have customer information to be able to follow up on.
Excellent, yeah. Okay, let's take a look at, got another question here. And this one might be for you, Stefan, as well. Who, if anyone, is regulating and enforcing these rules? And I know the governor touched on it a bit in his press conference yesterday. Stefan, do you want to take that one?
Sure. It's a great question. So these are legal orders statewide that apply to counties, and they apply to county governments, which entails law enforcement, county attorney offices. So our county public health offices and our county health officers do have that authority to enforce these rules. So we have seen in the past, month plus, for example, about a month ago, I believe there was a bar that was open in a particular county, and the county health officer went and had a conversation to make sure that bar shut down. So it is legally enforceable. I think what most county health officers and county governments are doing, we don't want to have a big police presence or law enforcement presence to be doing this. What we're really asking for is for the public and for you all, our partners in the business community and small businesses to help us and work with us to keep our population safe. And we know it's a tough time and really a lot of uncertainty that we wish wasn't the case. But yeah, these orders are legally enforceable, and county law enforcement, local law enforcement can enforce them. I think in terms of actual punitive measures, what the outcome would likely be is civil types of citations, so tickets essentially for businesses. That's how most states have handled the legal aspect of their public health orders, and it would be relatively similar here in Wyoming.
Very good. Thanks, Stefan. All right, so here's a question from Tiffany. She says, hi, I work at a counseling agency in Evanston, Wyoming. We have moved over to telehealth easily, but I know that staff and clients alike are anxious to get back to face-to-face. If we can easily work from home, at what point should we begin to phase back into the office?
Yeah, great question, and howdy to our folks in the western part of the state. When it comes to healthcare facilities, including mental health providers, there's nothing in the orders that has closed you. And we know that a lot of businesses have taken proactive measures to, encourage teleworking and teleservice as much as possible. And a lot of our outpatient mental health services fall into that bucket. So my frustrating answer to the question would be to, talk to your supervisors or your ownership, your leadership on what that process would be. And I would also say that reach out to the Behavioral Health Division at the Wyoming Department of Health, who not only finances and regulates our community mental health and substance abuse centers, but also has a licensing arm for mental health providers throughout the state. So while there's nothing in the orders that legally closes a healthcare facility, I think the proactive thing has been, well, let's limit our in-person contact. Let's be as safe as possible. So it really is kind of a local and a business decision there when it comes to reopening. But there's resources from our department and folks who will be happy to provide some technical assistance on those questions. So great question.
All right, here is a question from Pam, who says, I'm going back to work tomorrow in a hair salon. There have been individuals who are creating a liability waiver. Is that necessary? And if so, what should it cover and who does it protect? Sharon, maybe you can help with that one.
I honestly don't know that I can help with that one. We're public health protection, something on a legal matter like that. I'm not really sure. We have been advising people to talk to their insurance providers, thinking that that's probably the best road to take. And so unless somebody else has a better answer, that's what we've been suggesting.
No, Sharon, I think that sounds good. And I think it's from our perspective, that's probably the best way to do that is to talk with if you have a legal advice through your business or through your insurance carrier. I think those would be the best first steps that you need to do. There is nothing in the order that says that you must have a waiver. I believe, Stefan, is that correct as well? That there is no wording in the guidance that says you must have a liability waiver, but that is up to you as a business on what you want to do there.
No, Josh, that's absolutely right. And I think the advice that you and Sharon just gave is good. We don't want to be, in this type of setting providing legal advice to you, because that's something you should, as a business, get, like Josh said, through your legal counsel or through your insurance carriers, et cetera. But we've heard similar things of businesses, who have either been operating under an exception or a variance, or been operating in limited capacity over the past month, that are taking certain measures to, get customers to sign things or things of that nature when it comes to waivers. But yeah, I think the best advice there is talk to your legal folks or your insurance carriers on those decisions.
Here's a question about the masks that must be worn by employees and clients in businesses such as massage therapy. Are the homemade masks sufficient, and are employees to change masks out between each client?
Yeah, that's a great question. So first answer is yes, homemade masks are sufficient. What we don't want there to be a misunderstanding out there is that these need to be, you know, medical grade masks, N95 masks. We're really, as a state and as a country, trying to preserve those for our frontline healthcare workers. So there's a lot of guidance on the CDC's website. We've linked to it on our website of how to make, if you need to make a mask. Out of, you know, a T-shirt or a handkerchief. That's certainly there's some good how-tos out there, and then also just general, you know, face coverings will be sufficient too, and you can, you know, those can be purchased or made. So certainly no need to have a medical grade mask for that particular provision of the order.
Can I,
And then
can I ask a question on that question, Josh?
sure.
You bet, Sharon.
I'm glad this came up because we've had a lot of questions as far as clientele wearing masks. We know that if somebody comes in to get a service for their hair, we can generally work around a mask, but there are a lot of facial services where that's going to be tough for the client. We have been recommending that they still come in with their mask, and they go through every piece of that service they can with it on, and then remove it when necessary, and then put it back on. Would that guidance be correct?
Sharon, this is Stefan. Yes, I think so. And what I'll clarify here is, again, in paragraph 2 of order number 3, you'll see that all patrons must wear face coverings, quote, as much as possible while receiving service. So we know there needs to be some flexibility depending on the type of service and depending on the type of business. But again, this comes back to, and state health officer would probably hate me for saying this, but we need to partner together. We know there's going to be some interpretation differences and some flexibility that just needs to be here. But we really want our businesses, and in this case, our personal care businesses, try to be as safe and responsible as possible. That's what this is all about. So when it comes to the patrons, the customers, you know, you do see that in the order language, wearing face coverings as much as possible. Now, staff during the service, that is required to wear face coverings. You know, all staff will wear face coverings. But when it comes to the customers, I think there's some room for flexibility there. But ultimately, as the governor has mentioned several times, you know, as we ease these restrictions, what we don't want to do is have to come back down with the hammer and say, okay, we did this for 2 weeks and it really just didn't work, and we saw a resurgence. And if we don't want that to be even perceived as it's because, you know, businesses or folks weren't complying. And we know you're all trying to do your best to step up to the plate and help us with this situation. So that's really what we're trying to avoid. But Sharon, to answer your question directly, I think there's some flexibility there with customers and the face coverings.
Thank you.
All right, the next question is about from Anka. It looks like looking at the complete public health orders, it says that personal services are ordered to still stay closed till May 15th, besides massage therapy for medical purposes. Which rules are we supposed to follow? So it looks like, Stefan, if you could clarify that and make sure that everyone is clear on the personal care rules from order 3, that'd be great.
Sure, good question. And this is why a lot of us didn't go into the profession of law, because legal language can just be frustrating and infuriating sometimes. So you're right that the personal care services are ordered in the first paragraph to remain closed until May 15th, but it's subject to the provisions in the next paragraph, in paragraph 2, which then opens you so as a personal care business. So it says the closures listed in paragraph 1 above, so the closures, may open in a limited capacity under the following conditions. So the rules to follow if you are going to reopen as a personal care service would meet all of the conditions in paragraph 2, which has A through J in the sub bullet points there. So again, I'm not an attorney, and I love our Attorney General's office and all the lawyers that I get to work with on a daily basis, but it is a bit confusing from a practical and a reality perspective. So take a look at order number 3, which again, you can see links to it on your screen right now. I know it's on the Business Council website, the governor's website, our website, but pay attention to paragraph 2 in order number 3, which says, okay, we know you're closed in paragraph 1, but if you can meet these conditions, then you can open in that limited capacity. So I hope that helps.
Yeah, that's those are challenges, but at the same time, I think the point is that the order is saying it's not wide open and everything is just back to normal. But if you meet these conditions, you may open, and I think that's a key component for everyone to understand. And again, if you meet the guidelines that are listed out, you may open in that limited capacity while meeting those guidelines without asking the county health officer or state health officer or anyone else in that regard. But I do want to go ahead and touch on a couple. Well, you know what? Let's take one quick one. I think there was a quick question about let's see, a travel ban, and while it may not be the topic of this particular webinar, I know that it's been asked a little bit. So let's see, what is the travel ban starting on May 1st? And Stefan, you probably have a bit of insight into that. I'm not positive. I do know that the governor did mention some things about perhaps state parks, getting some more information on those today. Not sure about people coming into the state, but Stefan, do you have any insight there?
Yeah, and I'll double check to see if anything has changed in the last 24 hours, but there's no quote unquote travel ban to my knowledge, but I would encourage everybody, go to Governor Gordon's website, because there's two things here. The state health orders are really coming out of Department of Health and the state health officer, and there's 3 of those. There's also other directives and executive orders that have come out of the governor's shop over the past several weeks. And one of those that I think is being asked about is, travel restrictions. And there is an executive order in place that for folks coming into Wyoming from out of state for non-work purposes, that there is a directive to self-quarantine for 14 days. And I believe that is still in effect, but keep in mind that does not apply to anybody coming into the state for work-related purposes. It was really intended to prevent. We were seeing some folks come in when our other states, our neighboring states, were closing, and seeing some campers come in, some travelers come in, and worry about the spread of the virus from those states into Wyoming. I have heard, and I'm not sure if it's official yet, but that state parks will be opening up camping, and I believe it was announced this morning, will be opening up camping on May 15th. State park campsites to Wyoming residents. So still they will be closed to non-Wyoming residents or out-of-state folks. But that's, as I understand it, coming into place on May 15th. But again, would just encourage everybody, go to the Business Council's website, go to the governor's website, and take a look at those orders, because as painful as it is to read legal language sometimes, that's where you're going to really see what's in effect and what isn't.
Yeah, thanks, Stefan, and thanks everyone for joining in today. I do want to reiterate there were a couple questions still on the process and whether the state health officer would be taking those exception and variance plans. And remember that it is important to work with your county health officer first. You can do that as an exception as an individual business, or if you wanted to work collaboratively with those in your community that might have the similar challenges for their business and the county health officer to work together to get a countywide variance, you may do that as well. Those are your options for that. And we do want to stress, I think this is an important time to understand that it really is more like a dimmer switch, not an off and on switch, and something that we're going to approach from a data-driven perspective and taking a look at what we can do. Again, knowing your counties are very different, and the spread of this particular virus is different in each of those counties. Just remember to work with your county health officer first, and then take those forward to the state health office. And so we're obviously here to help. We want to continue to help with these webinars and bringing the experts in and helping you through this challenging time. But it's definitely a time to look at your business and say, how can we, are there things that we can do? What can we learn from this? How can we improve our business so that as we emerge from this and into the recovery phase, that we can actually be stronger. And I think one of the senses is that getting with your community and understanding your customer and understanding those other businesses in your community has never really been stronger. I've heard a lot of very, very positive stories about that. And I think it's a time for us to do that. And it is extremely frustrating. I think that you can tell from some of these, the questions that have come in and some of the answers that we have, that it is a challenging time because we just don't know all of the answers here. And we want to do the right thing for public health. So thank you all for joining today. We're going to have 3 more sessions of this, noon today, as well as 8 a.m. and noon tomorrow on Friday. So best of luck to you. Please reach out if you have any questions for us, and we'll be happy to do our best to answer them. And we really appreciate your time today. Thank you.